About why we use group therapy as a treatment modality for substance use disorder and what goes into the making of a good group and a good group facilitator. Oh, for some reason there we go. And as always, I have a hard time seeing the chat box when I'm in presenter mode, so please feel free to unmute and interrupt and ask any questions or share any tidbits along the way. So for those of us in the therapy world, we see firsthand the importance of the work we do, the effect it has on our patients' long-term recovery. And maybe for other medical diseases or disorders, sometimes the treatment just needs to be medication. But we know for our folks with substance use disorder, adding therapy and specifically group therapy to the treatment plan helps in so many different ways. It's a way for our patients to learn about various resources at one time and also get various viewpoints on issues that they may be struggling with. Within that group therapy model, it can help our patients, they get an opportunity to develop coping skills to help them with their recovery, and then also give them that time and space to practice them firsthand with each other before they're going out back into their old environments or their family members to try them out. When we hear from our patients over and over again is that support, the validation they get in group, the accountability that they get from their peers is just immensely helpful. The support the hope is the support they're receiving in that tiny little group community helps them understand the power of community and how that sense of belonging can really add to their motivation to stay sober. So if they're getting it in our groups, can they then leave and go out in the community and find it elsewhere, maybe in the 12-step community or other types of communities? They get the chance to learn from each other's successes and struggles. So if somebody in group, if something went really well for them, they may try to copy, what it was they did for that specific relapse prevention plan. Or if something didn't go well, something went poorly, so, folks are able to learn from that as well. They may be able to go, oh, I think for me, I need to do something differently because that just didn't work that time. And then finally, from an agency perspective, group therapy allows us to provide treatment in an efficient manner, both time-wise and cost-wise. And anybody that sat in presentations with me before knows that I always include farm pictures. So there's my little group therapy at home. So the group therapy model has multiple benefits. There's also a few drawbacks that we need to appreciate. Excuse me. The group model does limit our ability to individualize each session. So I'm not going to necessarily be able to give every single patient the full amount of time that they want to share. Otherwise, I'm going to potentially run out of time. And so that addresses the issue of time constraints. A 60-minute session can feel like full hours, 4 hours if you have an entire group of 0 talkers. A 60-minute session can also feel like it's lasting 15 minutes if every single person in there is talking and talking a lot and has something important to say. Some patients just may not feel comfortable sharing certain personal information in a group, especially if these folks are living and receiving treatment in a small town where everybody knows everybody. We stress group confidentiality, but while my license prohibits me from sharing people's information, patients in a group don't have that. So we ask them to keep things confidential, but we can't 100% prove that they're going to do that. Some individuals may take over the kind of group time and talk a lot or talk about topics that aren't appropriate for your group environment. So that's a thing you have to address in the moment. And then finally, managing the different personalities of a group can be a lot and can be exhausting. If you're working with a group of folks with substance use disorder and there's maybe patients in there that have other untreated mental health disorders, the symptoms can really interrupt the group cohesion, or folks who aren't really comfortable with or have practice with being in a group where folks have different personalities and different opinions. I use this picture as an example. We have the late but great Douglas Harvey calmly talking during our group meeting, and then we have Dr. Berry flipping me off in the meeting. So an example of how do you manage the different personalities in a group setting. I'm sad that Jim's not on this call to see that. So let's talk about what makes up an effective group therapy model. For each group, we want to make sure there's an aspect of building rapport with our patients and then also giving them the opportunity to build that rapport with each other. We want to establish the rules of the group setting in a way that feels supportive and not just disciplinary. And each of these we're going to talk about in a little bit more detail. We want to inform them of what the agenda for that session is, and that can help with sort of setting up the expectations for them early. We want to manage individual participation, again, in a way that feels supportive and inviting and not forceful or disciplinary. We want to respect and appreciate the diversity that exists in each of those groups, and then at the same time, find a way to honor the universality of all of the group member connections. So for client engagement and rapport building, again, it's really both about the facilitator building connections with the individual patients, and then also allowing the opportunity for the patients to build connections with each other. Sometimes allowing for chit chat at the start of the group can actually be helpful. It's just kind of a way to warm people. It's a way to warm up the atmosphere, give everybody a chance to check in with each other and talk about something that's maybe a little bit more lighthearted. And then more formal ways of doing this can be, dividing the group up into pairs, giving them each of maybe a topic to focus on, which can help build those connections within that pairs early on. That can be really helpful if patients are new to the group. And if we want our clients to be engaged, that means that we need to be engaging as well. I've heard running a group therapy session, I've heard it be compared to giving a performance. So the attention to the moment, the connection with the audience is going to hopefully increase the momentum that they're bringing to the session as well. So if we're bringing energy to the group, it's not going to automatically guarantee that everybody will do the same, but it might increase those chances. Excuse me. So in terms of establishing rules, every group needs to have them, but I think how we put them out there can really help or hinder that connection with our patients. So I think how we're setting them up is going to alter how the patients are perceiving them. If we start each group with just this laundry list of do's and don'ts and present them as you got to follow these or you're out, that sort of inadvertently creates kind of us versus them atmosphere. And I think more if we discuss our rules as opportunities to honor the work that takes place in that group therapy setting, if we talk about our rules as positive boundaries to respect their needs, that hopefully will have the potential to be heard differently by our patients. And then throughout the group, how we're kind of holding patients accountable to it. Sometimes they just might need more reminders as opposed to being called out on certain rules, if that makes sense. I really like the idea of starting at the start of each group, kind of letting the folks know what our agenda is for the day, what's going to be the organization and structure and what we're going to talk about. I think this has a little bit of a trauma focus element to it. It's sort of here's what we're going to talk about, and I'm mentally giving you time to prepare for it, especially if this is going to potentially be a tough topic for you. In terms of coming prepared, our patients are smart folks. They can tell when we are coming to group with prepared ideas that we're excited to review and process with them. And they can tell when we weren't prepared. I think they can tell when we've just pulled some random worksheet out of an addiction workbook a couple minutes before a group. They're pretty good at reading people. And so while we want to be prepared for topics that we think are going to really help them in the moment and things that we're excited to process with them, we also want to make sure that we're flexible with the needs of the group. If I come to my group today and I've got plans to review boundaries, and during that initial check-in session, I find out that 5 of my 8 group members experienced some sort of loss this past week, I want to make sure that I can pivot to talk about grief instead. I got to meet the majority of the group where they're at. And then, as always, I think it's a great idea to be able to ask our group members for ideas. Find out what are the things that they want to talk about, the things that they've been struggling with, the things that they would find helpful talking about in a group therapy session. And that can be a nice way to kind of get a little bit of a buy-in from them. Let's see if my voice lasts the entirety of this. So managing individual participation. So we have all probably experienced those groups where you've got 1 or 2 super talkative people and then multiple group members who won't say a peep if they're not called upon. And so there's ways to draw out and there's ways to respectfully therapeutically cut off folks. So ways that we can maybe draw some of those quieter folks out would be holding, round robin sessions. It's where, everybody, you're sort of checking in with every person in the group and expecting them to share. Doesn't have to be a lot, at least a little bit. And sometimes we can individually call on people or ask group members to pick the next person to share. That's what I'll often do. If I have a group that's got some talkers, I may call on Elizabeth to share her thoughts. And when she's done, I may say, hey, Elizabeth, who do you want to hear from next? So that's going to hopefully sort of keep everybody on their toes and paying attention more. And also that expectation that we're all here to share a little bit. And if you've got a group where the majority of folks are quiet folks and potentially shy or socially anxious, those are some times to maybe break the groups up into smaller groups where they can just talk amongst 2 or 3 patients, and then they can come back to the bigger group. And then also it's a good reminder that silence is okay. If we throw a question out there and we're not immediately getting an answer, I know that's a little bit of the echo strategy too. If we put a question out there, we want to give time. We want to give folks the time to really thoughtfully think about it and think about different perspectives before they have a response. Now about those super talkers. So I probably find cutting people off to be, I saw that hand raised. I find cutting people off to be one of the most difficult actions. It feels like it goes against my role as a therapist. This person is sharing their thoughts and feelings, and I'm going to do something that communicates I don't want to do that, or I don't want to hear from them. It just feels icky. I don't know what the therapeutic term is. It feels icky. But it's necessary, right? We want to honor the needs of the whole group, not just Talkie Talkerson. And so I think this goes back to our setup of cutting that person off. If I just say, hey, Andrew, you're talking too much. You need to stop. That's not going to go over well. Really, that exhibits that I don't care about what he's saying, and I'm doing it in a pretty disrespectful way. If instead I say something like, hey, Andrew, I'm really valuing what you're sharing with us, and I also want to make sure we get to hear other people's perspectives. It's kind of politely reminding him that he's in company with other folks, but not doing it in a way that feels harmful. If it's a continued pattern, if you have a group where that's consistently happening, you can always put a time limit on each group member share. Sometimes it's also helpful to give that talkative person a job. So if today we're talking about coping skills and Andrew's my talker, I may say, hey, Andrew, would you do me a favor? Would you mind to kind of keep bullet points on like the main coping skills the folks are going over, and then we can read through that list at the end. And that's going to give him a job and potentially take some of that extra energy. And again, after that, if it's a continued pattern, you can always talk with them individually after group. And it's, again, with the intention of I'm appreciating everything that you're bringing to group. And I know for quieter folks that maybe they may have a hard time cutting you off. So how can we kind of work on that together? And almost always, if I talk with patients individually about it, they get it. And I'm also we're probably not the first person that has told them in their life that they talk a lot. And we want to respect the diversity within our group and honor the unique experiences that each of our group members have lived. And so, asking who has had a different experience can invite that discussion. And then validating their differences, saying hey, this is very normal. If it's impacted us differently, that's another way to honor their unique experiences and hopefully encourage them to speak up if they're thinking, oh, well, my experience was, totally different than what Hunter shared. If we can remind them that that's absolutely okay and in fact expected, that may be more likely for them to share. And then recognizing the strengths is a way to also praise your patients, saying things like, gosh, I'm always amazed at how people can find different paths to improvement, or it's so great that you found a way to handle a situation while staying true to yourself. So again, I just keep going back to that word honor. It's just honoring the unique differences of our group members. And then while we want to respect the diversity among our group members, we also want to find a way to help honor those connections between them and hopefully continue to build bigger and stronger bridges. And so when members are sharing about something they've been dealing with, we can ask them, we can ask the other group, hey, who can relate to that? Or who can share something similar? We can ask them, hey, show of hands, who else has experienced that, which can be really validating for the person in the moment. And then when you notice that somebody, one person in the group shares something similar to somebody else, it's up to us to kind of point out this connection. Say, hey, it sounds like you and so are dealing with a similar issue, or it sounds like you and so were kind of, struggling with the same thing last week. Another way to kind of build that group cohesion. And so to start to wrap things up, we've talked about aspects of an effective group leader. So we want to be present, we want to be engaged, prepared, and also flexible. And what's really helpful for us is that we can be comfortable with the uncomfortable, because working with humans means that we're going to encounter their and our own humanness. And so we want to use our own personal supervision or consultation to really explore how we feel about conflict, how we handle conflict, and whether that's an area that we need to grow in. We want to be able to kind of explore what types of group members are the ones that get under our skin the most and why. If I had 5 therapists in this office, probably all 5 of us would have a particular kind of profile or archetype of a patient that they struggle with the most. Some therapists would say, oh man, I'll take a room of over talkers or angry folks anytime over a group where it's just like crickets in the background. And another therapist may say, oh, I can handle crickets because I can draw folks out. But when people are sort of angry or irritable in a group setting, that's overwhelming for me. There's not a right or wrong answer there. It's just about, kind of figuring out what's the type that you struggle with and maybe reflect on why, and then what you can do to address that. And then generally, how do we deal with our own emotional discomfort? And how do we believe that we have all the answers? And what happens if we think we have all the answers and a patient asks us a question we don't have the answer to? Which happens. Excuse me. So finally, I want to leave you with a list of just common group therapy strategies. I know for me, my group therapy topics can get a little stale from time to time. And so sometimes if I get with a colleague and kind of get a group topic idea that they have been using or they recently used in a group, it actually ends up perking up my own ideas. I reached out to with the help of Mitra, she reached out to the ECHO community for me. Thank you so much. And I also reached out to my own colleagues, and here's what everybody in this group and my colleagues here shared as really helpful group strategies. So I mentioned earlier that round robin, just the idea of kind of getting a buy-in, a check-in from every person in the group is a way to initially get everybody to participate. Some folks talked about that they divide the group time. So they will, I'll just sort of make times up. They'll use the first 15 minutes as a check-in session with the patients. They'll use 15 to 20 minutes for sort of a didactic style similar to this. And they'll use the remaining time for kind of process and discussion what they learned. And sometimes they'll even use a timer, or again, that'll be a job they'll give a patient of like, okay, I want you to let me know when the time's up and we need to move on to the next section of group. Sharing articles, a lot of folks talk about that they try to stay kind of abreast of addiction, how it's showing up in the news in terms of affecting community, but also treatment and recovery and resources, and that their patients really like when they kind of come to group and say, hey, I learned about this new treatment technique or this new thing in research, and patients like to know what's going on in their field. Worksheets can be really helpful if you sort of give them the opportunity to work on them and then come and bring them back to the bigger group to discuss. You kind of have to be cognizant of what is the literacy levels of your patients in your group. And so make sure that we're respectful of what their reading or writing needs are if you're bringing any kind of work like that. And then games and activities. We adults, myself included, are just big kids. So sometimes we want to be able to participate in things in group that are lively. I got this feedback from Jennifer Boyd. I don't know if she's on the call. She said, please pass on to Katie that the therapist I worked with developed a substance use disorder Jeopardy game that she played with our groups in October. And everybody loved it. I didn't get to participate, but I could hear the lively interactions in my office. And so I loved that. And those are my slides.
Thank you so much, Katie.
Thank you so much. I'm going to mute myself and cough.
Okay, well, you did wonderfully. First and foremost, I hope you feel better and okay, because you sounded great.
So much better than last week. Thank you.
And you know, I always appreciate your cute farm animal photos, but I really, really love the one with Douglas in there. So thanks for adding that as
I know,
well.
I liked that he got to visit our group today.
Yeah, that's awesome. Thank you so much, Katie. Did anyone have any questions, thoughts, or comments? And I'm gonna take Katie's advice from her lecture just now that I'll let everyone have some time to process and think. I'll be okay with the silence for a little. So just feel free to unmute or chat in at any time. And I'm happy to read out any chats. It is interesting, Katie, though, how you said having like the crickets and like having it quiet and like being okay with that. I know when I first started with Echo, I was like, oh shoot, am I doing something wrong? And I'm sure there's kind of overlap too as a therapist and stuff. Not that it's the same, but you know what I mean.
No, it is, and that's a good point. That was I'm comfortable with that in the group therapy setting. And I remember when I first started Echo, that was hard for me. I felt obligated to want to fill in the silence, and somebody had to remind me, like, you know, it's sort of similar to therapy. You got to give folks the opportunity to just sit with things. So I needed that reminder also.
Exactly. And do you find if you do like Zoom therapy and things like that, virtual therapy, do you find that the silence is there more, it's more prevalent, or compared to in-person therapy?
That's a great question. I would say that's not an area that I find that there's a real difference in. There's maybe a couple of things about group therapy in general that there's a noticeable difference between online and in person, and I would say silence is not one of them. Great question.
Thank you.
Yeah.
Anyone else with any thoughts, comments, or maybe your personal experiences that you'd like to share with the group as well?
Yeah, for the record, I'm always trying to steal group ideas. So if there's anybody on the call that, you know, if you've had a kind of lively group, you know, lately, if there was a you know, particular something you brought to a group, I always love to hear what those ideas are. I'm also noticing we don't necessarily have a ton of group therapists on the call,
so I've got a group that I call Getting Ducks in a Row, and it involves a bunch of rubber ducks that have all been labeled stuff like Vivitrol, Suboxone, dealers. There's one that says stupid shit, sex, relationships, parents, all that stuff. And the group I dump them all out on a blue tablecloth, and the members take each turns, and they'll pick up one like, oh, Suboxone. I have two boxes, a green one and a red one. Good thing or bad thing? Oh, Suboxone's a good thing. Dealers are a bad thing, until we have all the ducks separated.
I love that.
If you email me, I'll send you my PDF of all the instructions. And then after that, I designate one person to be the Vanna of the group, who puts the ducks in order with the group. And then they present why duck 1 is duck 1, duck 2 is duck 2, duck 3 is duck 3, and so on.
Oh, Nick, what a great, so interactive and kind of keeps them on their toes, and such an important thing to be talking about. I love that idea.
Thanks. Thank you. Presented it at the social work convention before COVID.
Oh, I bet you had a lot of folks that stole that idea from you.
I hope.
Yeah. Oh, I love that. Thank you. Tanya, I saw that you wrote in the chat box that you do substance use disorder hangman.
Yes. So it's pretty cool. And we use 12-step sayings that go along with it. Because a lot of people are not exposed to or attend 12-step meetings.
Yeah.
So, and then that gives us an opportunity to talk about those. And so they'll play against me. So they take points away from me. Yeah, it's really cool. I've also been looking at doing a substance use disorder, like a trivia. And so we've gotten a little busy recently, but I haven't got to explore that anymore. A lot of we pull from the Matrix, from SAMHSA, and so they have an older video series that goes along with this. which shows real life. So I do use that. I use this more for my IOP groups.
Sure.
And then for my people who are more advanced in the recovery, we do a lot of mindfulness, or I incorporate a lot of meditation. Or before this last big surge of COVID with Delta, we took a pineapple and we used our five senses to describe that pineapple, and then we all got to enjoy the pineapple. But it's a very basic, just being aware of what that pineapple, how it feels, looks, tastes, smells, all that stuff. Yeah, we get pretty creative over here, but I would be happy to share any of my groups and information. So
first of all, Tanya, I love all of those ideas and totally going to steal the hangman approach. And I'm betting if you have any of those written down, I'm wondering if you could send those to the awesome Echo folks, and then when they send out the notes for this meeting, they could attach those to them. Thank you both so much. I love those ideas. And now I've got curriculum for the next 2 weeks, so thanks.
Yeah, thank you both so much for sharing everything. So anyone else with any comments or questions?
Can I real quick share about the past week? I did the children's story, The Giving Tree.
Oh.
Does everybody know that story about the giving tree, the tree and the little boy who keeps coming and taking from the tree?
Yes.
Then there's an alternative video, and it's about the tree who set healthy boundaries. So the first week we watched that, and then the second week we talked about, because we're preparing for Thanksgiving and sharing that holiday or upcoming holidays too with families. Yeah. So we got to watch that, and the tree who set healthy boundaries was great. Like, it was really good. So we got to do, like, we made a list of like toxic traits that we find in people, whether it be our work relationships, our friendships, people we encounter at meetings, wherever. And then we talked about using I statements and setting healthy boundaries, and it was really fun.
Oh, Tanya, I love that. I haven't seen the video I've sort of read the transcript of the tree with healthy boundaries, but I haven't seen the video that goes with it.
And then at the end of it, we did like a gratitude meditation just to bring it down and focus on some happiness. So yeah. I will happily send that out. Unfortunately, you can use it next year, but you can still do the tree and the boundaries anytime.
Oh, yeah. Oh, yeah. That's perfect timing. Tanya, I love that. Thank you. Great idea. Thank you, Nick.
I love the mindfulness meditation too. I'm trying to do guided meditation here and there, and for me personally, it's very helpful. So
I wish I could do it. I just can't quiet myself down enough. So that's something I really need to work on. I know that's not probably a surprise to everybody, but awkward silence moments. I'm not good at the crickets. I'd rather be in a room trying to calm people down. Like, I'm a person luckily I have my husband now, but I'm a person on a date. Like, if we aren't talking, I'd probably pull up like questions to get to know somebody, because I do not like that at all.
Anyone else with anything they wanted to share with the group? Alrighty, well, if you all think of anything after the fact, as always, shoot me an email. I'll make sure to attach it in the recap as well. I just got some items in my inbox, so I'll make sure to attach those in the recap as well. And Katie, I'll send them your way to have.
Thank you.
But thank you so much, Katie, for the awesome didactic, and thank you all so much for joining today. My only announcement is that our next session will be on December 13th, and Olivia Higdon will be presenting on communication methods. So thank you all so much. I hope you have a wonderful Thanksgiving, and I'm super grateful for all of you. Thank you.
Thanks,
Thank
everyone.
you too. Thanks, everybody.
Bye.
Bye.